Hello there, I'm Dr. Duncan Wheatley. I'm a clinical oncologist in breast cancer and I work at the Royal Cornwall Hospital. And I'm going to explain to you why we might recommend radiotherapy or chemotherapy to you after or before your surgery for early breast cancer. When we treat breast cancer, we treat it on an individual basis. So we're going to look at all of the factors, including what you're like, what other illnesses you have and your wishes. And also, we're going to look at all of your tumour features because no two breast cancers are the same. So we look at different features of your breast cancer to decide whether it was a nasty one that might need lots of treatment or a not very nasty one that might need very little treatment. Okay. We sometimes give radiotherapy when we've cut out your breast cancer. When you cut out a breast cancer, you hope that the surgeon has cut it all out. But cancers do spread around the breast or around the body, and the aim of this treatment is to kill off the remaining bit that's left behind. With radiotherapy, this is high-powered X-rays that we shine through your breast, and we hope that by doing that, any little tiny bits of cancer left behind will be killed off by the treatment. To have radiotherapy is very painless. You simply lie down flat on a couch, and we'll show you that later, and you lie there for a few minutes each day, and when you're having the treatment you won't feel anything at all. It won't hurt, you won't feel sick or anything like that. When you're having the treatment we'll all leave the room, but we'll all be able to see you and hear you when you're having your treatment, and there's nothing to be scared of. The machine will be a long way away from you and it won't hit you or hurt you. During each treatment, as I said, you'll feel nothing, but as the treatment goes on, your skin may get a bit red and inflamed, a bit like a sunburn, and some people get very little reaction, and others do get a brisk skin reaction, such as a sunburn, but this will fade with time once the treatment's finished. Some people get long-term effects of radiotherapy. These can include some tenderness in the breast, or some slight shrinkage of your breast tissue, or some slight discoloration of your skin over your breast. Very, very rarely some lung damage occurs, but this is extremely rare and not something I remember seeing in living memory. We make sure we avoid bits like your heart underneath, so the risks of long-term damage to other areas is extremely small. The reason we're giving radiotherapy, as I said, is to reduce the chance of the cancer surviving, and if you have a course of radiotherapy, you're about 3 or 4 times less likely that your cancer's ever going to grow back in your breast than if you don't have radiotherapy. So for nearly everyone we recommend it, but it will be down to you finally to decide if it's for you or not. When we give radiotherapy, we split the treatments up into several little doses rather than giving it in one dose in one big go, and there's a variety of ways we can do that. The normal treatment is that we give 15 treatments Monday to Friday for 3 weeks, and that gives a sensible dose of radiotherapy to kill the cancer and a very tolerable dose to your skin. For some people we also give a week and a half's radiotherapy extra, another 5 to 8 doses after the full breast radiotherapy, just to try and kill any remaining little cells where the tumour started. But we don't always give this. We also do many studies with breast cancer radiotherapy. Sometimes we're looking to give less doses to reduce the bad we give by radiotherapy but to keep the good, and sometimes we give higher doses to people with nastier tumours who we're worried that their cancer will still grow back despite the normal treatment. All these options will be discussed with you when you come to receive your radiotherapy, if they're relevant to you. Now this is the radiotherapy machine, or as we call it, a linear accelerator. And this machine actually delivers the radiotherapy that you're going to have. As you can see, this is a big room. You're not in an enclosed space. You're not tied down or held down. You're simply in the same position that you were when you had your scan to aim your radiotherapy. And you'll lie down here, Your head will be here and your arms will be out the way, held by this, rested on this position here. Now the radiotherapy actually comes out of the head of this machine. You can't see it or feel it. If it was on or off, you wouldn't know. This machine can spin around this way, and it can also spin around lots of different ways. So when you're lying down, the girls and boys in here aiming your treatment will be shouting out lots of numbers to make sure your radiotherapy is delivered exactly in the way that's been planned for you. So this machine will turn around and spin, but it won't touch you or go near you. It'll be nearly a metre away from you, and then the X-rays will shine through you from afar. So once you're all set up, then they'll ask you to stay still, and then when the machine's in the right position, everyone will leave the room, but we'll be able to see you and hear you when you're having radiotherapy, as behind us there's another camera and a microphone, so you can talk to us or we can talk to you and see what's going on. And when you're having the treatment, the machine will only be on for a few minutes at the most, and you just have to lie still. We can tell if you're moving and see if you're moving, so the machine can be turned off if there's a problem, which there rarely is. So the machine will deliver the radiotherapy from one side, and then without you moving, the machine will turn around and treat you from the other side, and the X-rays will shine through your breast, or if we're treating your lymph glands, through your lymph glands from the other side. Again, the treatment will just take a minute or two again. You won't feel anything at all when you're having it. You won't hurt, won't make you feel sick, won't do anything at all. The reaction you get to the radiotherapy happens as you go through the course of treatment, which, as we mentioned before, might cause some skin redness and might make you a bit tired, but you won't normally be unwell by this treatment. You may be treated on a different machine from this, but all the machines do the same thing. None of them touch you, none of them hurt, and none of them come anywhere near you. So hopefully seeing this, it will make you a less fearful thing to go through. And I promise you we are all very nice, and everyone will look after you as carefully as we possibly can.
When it came to radiotherapy, you go to the Sunrise Centre to have a CAT scan to put markers on you, so you're measured for your radiotherapy to make sure that the dose is very specific for where they want it to be. They tattoo these markers, which is very, very tiny. I can't even see my markers anymore. And then once they've done all that, your radiotherapy can begin. You have, or I had, most people do, 3 weeks of 5 sessions. It only takes about a minute to actually receive the radiotherapy. It takes more time to actually get your body lined up on the machine than it does to actually have the radiotherapy itself. There was no discomfort receiving the radiotherapy, and you just sort of got dressed and off you went. My breast tended to be warm at the end of after about a week of radiotherapy, the effects began to show. But all it was I felt as though I'd got a warm breast in comparison to the other one. The nurse was very sweet, and she told me to put a white cabbage on my breast and to help it soothe it, and it actually worked. I was amazed. So something very natural, very nice, but quite weird, I suppose, to have next to your skin. So by the end of the 3 weeks, you walk out and you feel free, and you've finished your treatments, and you can move on. There's no more regular hospital appointments to turn up to every other week, and you feel as though life gets back to normal after that point, which is great. You receive your appointments for the radiotherapy, and it's a set time every day, generally the same time of day, so it's a regular thing. The appointments are like clockwork. You are in and out of there within 10 minutes of actually walking in. You are back out of the doors of the Sunrise Centre again. It works really efficiently. So the rest of the day is yours. So whether you then go into Truro, have coffee, you can do anything else for the rest of your day. You're free. And at the end of the whole of the radiotherapy, it's all finished, and you move on.
I'm now going to tell you about chemotherapy that we give sometimes after you've had your breast cancer removed. Again, we look at your cancer, we look at the features of you and decide whether we think the cancer's probably not going to come back even if we don't give chemotherapy, or whether we think there's a very high chance that unfortunately some cells have spread away from your breast and will slowly grow and eventually sort of come back, although they were there all the way along. These are the cells that we want to kill off by giving drugs, and that's what chemotherapy is, it's drug therapy. Now, if we think that there's a high risk of your cancer coming back, and there always is some risk, then we may recommend a course of chemotherapy. And a course means giving injections, normally every 3 weeks, but there's a whole range of different ways we give it, and normally for 6 lots, but again that's very variable. And if we give a course of chemotherapy, we know this will reduce the chance of the cancer ever coming back, and it will increase the chances of you living without the breast cancer ever recurring ever again. Unfortunately, we all know that chemotherapy has side effects, and some of these can be unpleasant, but we look at that as a short-term unpleasantness to try and gain long-term chances of you living happily ever after. Now, the side effects are much less than they used to be because the drugs are less poisonous, but more importantly, the drugs we give with the chemotherapy are much better at stopping you feeling ill. Now, everyone dreads losing their hair on chemotherapy, and unfortunately that is quite common, but it will grow back again once you finish the treatment. And sometimes we use a cold cap, which is a very cold cap that we put on your head while you're having the treatment that may reduce the chance of your hair falling out. The other thing people don't like, obviously, is feeling sick or being sick on chemotherapy. So we always give very strong anti-sickness drugs if needed while we're giving you the chemotherapy, and we'll give you lots of these drugs to take home, which advise you take whether you feel sick or not for a few days. And these drugs are loads better now, and it's pretty rare that people are feeling dreadfully sick for ages. Another thing we commonly worry about is that your immune system will be very low on treatment. So we give nowadays the minimum dose that we think will do the job, and we also sometimes give drugs to stop your immune system dropping. That's just one injection the day after your chemotherapy, and this makes it much less likely that you'll get an infection that will end you up feeling very ill or ending up in hospital. However, if you do feel ill and get a high temperature while you're having chemotherapy, you'll have lots of phone numbers to ring and lots of support for advice as to what you should do. There are also many other side effects of chemotherapy. It can make you very tired and feel very washed out. Though there isn't much you can do about that, it will just wear off after a few days. It can also make your mouth taste, everything tastes generally horrible, and there's a variety of mouthwashes we give for that, or using fresh pineapple, but again it's a temporary thing that will go away. Okay. We'll also advise you, if you're young, not to get pregnant while you're receiving chemotherapy, and also some drugs have very specific side effects that we'll warn you about, but on the whole most people just feel generally groggy for a few days or a week after each cycle, at the worst normally, and then they'll pick up and feel fine again. And hopefully there will be some life during your chemotherapy, and then the pros of that is that there's hopefully a much better chance that your cancer will never come back and you won't ever need treatment again, and your life expectancy will be increased. Before you receive your chemotherapy, this will all be explained to you by me or whoever you see, and you'll also have a session with the nurses who give the chemotherapy, who will show you around the chemotherapy unit if you wish, and explain all the pros and cons of the treatment and give you a specific information leaflet about the specific drugs you will get, and you'll have ample opportunity to ask plenty of questions about it. No one wants to receive chemotherapy, but you have to look at it as a very unfortunate treatment that we may recommend. We'll always give you the choice that you don't have to have it, but you can always stop the treatment if you and I find that it's just not suiting you at all. But if it is recommended, then it's probably worth giving a go. As well as the other treatments, we sometimes give anti-hormone treatment after your breast cancer is removed. Each cancer we do a specific test on to see if it's the sort of cancer or not that is likely to be influenced by whether you have estrogen around in your body. Some cancers grow very readily if there's hormones around, and that's what we might want to stop, and others it doesn't make a difference. But about 75% of the time breast cancers are hormone sensitive. If we think there is a significant risk of your cancer coming back, we may recommend a course of tablets that you take for normally a minimum of 5 years, but sometimes longer than this and sometimes shorter than this. If you're still having your periods, in other words premenopausal, we'd normally recommend a drug called tamoxifen for 5 years. This is a daily pill that most people get on very well with, and we've been using it extensively for over 30 years, so there's a huge experience. Most people, as I said, do get on fine with it, but any drug can cause side effects, and the most common of these are hot flushes. Some people gain weight, but most don't. Some people find that they get problems with vaginal problems, either dryness or discharge, but these are generally rare. And if you are getting side effects, we can always think of alternatives. These again will be discussed when you come for your appointment. If you're not having your periods anymore and you're postmenopausal, then we sometimes still use tamoxifen if we think it's suitable for you, or we more commonly use drugs that dry up the remaining bit of estrogen you're making. And these drugs are called aromatase inhibitors. And there's 3 ones we mainly use. One is called Arimidex or anastrozole, one is called letrozole or Femara, and one is called exemestane. All of these drugs work in a very similar way, and they're slightly better at stopping your cancer coming back than tamoxifen in some patients. On the whole, they cause less hot flushes than tamoxifen, but they do cause some patients to get slightly achy fingers or joints in general, but not normally very bad. They can sometimes cause hot flushes, but normally less than tamoxifen, and occasionally they can cause some slight thinning of your bones that you would never notice, and we monitor this with bone scans and modify the treatments if necessary. However, most people get on with these drugs extremely well and take them for 5 years, and they generally at least halve the chance of your cancer coming back compared to not taking them. And the effects still work even after you stop taking them after the 5 years. So again, if you're prescribed these drugs, we'd recommend that you take them, and if you don't get on with them, don't be ashamed, just discuss it with us, and we'll see if there's any alternatives available for you.
The chemotherapy was a milestone, something my family were very concerned about, but I was just really positive that I had to do. It wasn't as bad as we all thought it was going to be. I was extremely tired, spent a lot of time asleep, but I wasn't sick once throughout the whole event, and I think that was what I was most afraid of. I got visions of spending all my time sitting next to the toilet, but not once was I sick. So the side effects didn't seem so bad for me. The experience chunted on. Once you got to the halfway mark, you felt as though you were coming towards the end. If it's like ticking a box every time you've had your chemo, that's one less you're going to not have again. The worst was losing the hair. I will not lie there. It's not a nice thing. But look at it now. This is only sort of, I suppose, 8 months of hair growth now, and I'm just chuffed to bits that I've got a lovely head of hair again. And so the loss is nasty while it's there, but there is light at the end of the tunnel, and that your hair will grow back. And I know we're all impatient. I'm impatient for it to get even longer than it is now, and I think that's just human nature. I started taking tamoxifen after I'd had the radiotherapy, which most of us are on, depending on your state of menopause as to what they give you. The biggest side effect of the tamoxifen is the hot flush situation, which ladies will be familiar with if they are postmenopausal. In my case, I was premenopausal. So it's frustrating, laughable. You get used to wearing lots of layers of clothes because you need to be able to sort of take a few off to make yourself cool again. I actually enjoy going outside in the cold sometimes, and people laugh at me because I just need to cool down. And I know this is going to be there for sort of 5 years while I take the tamoxifen, but I think the benefits of tamoxifen way outweigh the actual hot flush situation, which will eventually end, I know.